Indiana's weekly average for COVID-19 cases and Hoosiers hospitalized for the virus has grown over the last month. And while people spending plenty of time outdoors in the summer may help keep numbers down, experts say they anticipate more cases and reinfections as we head into fall. After averaging fewer than 250 new cases per day in March, last month the state averaged about 1,300 cases per day. Now, that's likely a significant undercount with so many people testing at home. Now, most of the new infections in Indiana are among 20 to 30-year-olds. We're joined now by Brian Dixon, a research scientist and director of public health informatics at the Regan Street Institute. Welcome to the show, Brian.
Thanks for having me, Joe.
So BA4 and BA5, now the dominant variants of COVID. How effective are the vaccines, boosters that people have gotten against them?
Yeah, so emerging data suggests that neither the vaccines nor natural immunity from prior infection are that effective at preventing reinfection with these new variants. However, there is evidence that vaccine and boosters are protecting people against severe disease, hospitalization, and death. In fact, we released a new study today that we published with colleagues at CDC, Kaiser Permanente, and others in MMWR that confirms the importance of keeping up with vaccinations. For example, individuals 50 and older, vaccine effectiveness against hospitalization was 80% following a fourth dose of the vaccine against the BA1 and BA2 variants. And so we're looking at data now on BA4 and BA5, and we're optimistic that we will continue to see strong performance against severe disease with these newer variants.
You know, we're into our third year of the pandemic. A number of people have been infected multiple times. So is each infection worse on the body, or does it drive more what we hear called long-term COVID?
Yeah, unfortunately, we don't have a lot of good data on this, so it remains unclear whether there's a cumulative effect from reinfection. So any kind of infection is a risky event for everyone, including the risk of long-term effects. So current studies are looking into these risks, but it's going to be a little while, unfortunately, before we know something more definitive. Individuals who are at higher risk of severe disease, therefore, should, in addition to staying up to date on their vaccines, they should also continue to take precautions like wearing a mask when they're indoors, especially in crowded locations and those with poor ventilation.
So how concerned are you about children going back to school in the fall, especially hearing less than a quarter of the state's 5 to 11-year-olds vaccinated?
Yeah, I'm actually quite concerned with the return to school that begins in just 2 weeks for some school districts here in central Indiana. Currently, cases are increasing, as you pointed out earlier, but it's also increasing in kids aged 0 to 11 across the state. They only account for about 5% of all the cases in Indiana, but cases overall are rising and hospitalizations are increasing, although slowly. But given that only a few school districts or no school districts will have any sort of prevention requirements like masks in place for this school year, and the high transmissibility of these new variants, I could see rapid increase of BA5, for example, in school populations when school resumes. And although the kids themselves are at low risk of hospitalization and death, we fear that they're going to take the virus home and spread it to those who are at higher risk.
All right, we have to leave it there. Again, thank you so much for your time. Appreciate it.
Thank you so much.